Welcome back. You're watching Newsline, and it's now time for our Health Talk segment with Dr. Orawan Gichiwengun. Today we're going to talk about food intolerance. Let's have a look.
Good morning and welcome to today's Health and Beauty Talk segment. Today we are here to talk about food intolerance. But before that, let me ask you, did you know that chronic diseases are actually signs of food intolerance? And today we're here with Dr. Orawan, the owner of Dr.Orawan Holistic Institute, who's an expert on this topic and will tell us ways to solve this problem. สวัสดีค่ะ Could you please explain to us what's the difference between food intolerance and food allergy?
Food allergy, I will talk about food allergy first because we are familiar with food allergy, because when you allergy to food you may have hives, you may got diarrhea, you may have sneezing or even asthma attack. This is the IgE, immunoglobulin E, food allergy. But for food intolerance, it's another kind of immunoglobulin G that the antibody in the body system tell us that we are cannot tolerate that kind of food, and it's come out with other kind of symptoms like you may have migraine, obesity, repressive or even autistic child come from food allergy too, and someone who have chronic fatigue syndrome and cachectic can come from food intolerance too.
So many of the diseases are actually from food intolerance.
Yes, they found that nowadays 70% of unknown etiologic diseases come from food intolerance.
I see. So that's the main cause of most of the diseases that we're facing today.
Yes.
I see. So could you explain to us some of the main symptoms of food intolerance? What should we look for?
Yeah. I think any kind of disease or symptom that are peculiar and we cannot find the cause, we may look at the food intolerance, because it's an easy test. You just take your blood 5 drops from the tip of the fingers or from taking
only
the blood.
5 drops.
Only 5 drops. It's half cc only, and sent to the lab. They will have the test to see what kind of food that you are intolerant to, which they will test about 250 kinds. And it's very easy. When you know what you are intolerant to, you just stop taking that diet. Then all the symptoms will be gone. I found many clients who have severe migraine can be cured by easy. Some of them found that they are intolerant to rice. Even one of my clients who are very obese, she's about 65 kilos something, and after she tested and found that she are allergy, because allergy is intolerant to pepper.
Pepper?
She can take pepper and nothing when she take it, but after stop taking pepper, her body weight lose about 17 kilos in 2 months.
So that's the cause of obesity in her case.
Yeah.
Wow.
Even one cases have cachectic and found seek many doctors to find the cause, and he do all the tumor marker tests, all the CT scan for all systems to find the cause that make him cachectic, and very afraid that it may be cancer, but just do the food allergy test and found out that he allergic to cow's milk and egg, which he took a lot every day to gain weight, and now just stopping, he gained 3 kilos now in 3 weeks. This is very common cause that can cause diseases.
So it's like something under the radar that we don't even notice. Am I correct? Wow. And is food tolerance actually considered as a disease?
It's now it's not disease, but it's cause disease, because like it's from an immune complex, and when it lodged to any organs, it make aberrant of that organ, and even can make like depressive that you don't know the cause. Even if you take a lot of medicine, it's not cure at the root. The root is easy. Is you take off what you are intolerant, then all things will come to normal stage.
I see. And you mentioned before that sometimes it causes obesity. Is it in every case or in just some certain cases only?
70%.
70%.
Yeah. Nowadays in my practice, if you consult me about how to lose weight, I will let you test this first to know are you intolerant to some kind of food, and then just cut it out. Then everything will slim up very easy. Yeah.
Also, people go to fitness and they don't lose weight. It's maybe sometimes because of food intolerance, right?
It can be.
I see. And is there any way that we can be treated apart from avoiding the specific food? Is there any medical treatment that should be considered?
If you have symptoms severe like migraine or anything, you may use as supportive with the conventional medicine, but the best is just quit what you're allergic to. And within 3 days, some people cure only in 3 days. That's better to quit. But if you have very severe, you may need something to help. Like sometimes I use the conventional medicine to help my clients. Sometimes I use homeopathy to bring up their own immunity, their own energy to treat by themselves too.
I see. But apart from, as you have said, getting blood drops from yourself, then you would know that you're allergic to some food. Are there any other ways that we can know that we're allergic to this type of food?
Or we cannot know by other ways because this even a famous doctor or very keen one cannot tell you. Even you yourself cannot observe what you are allergic to because you need the test to help you.
I see. So the test is very important.
Very important.
I see. And I'm just curious, like, what are the most found symptoms, or what type of food intolerance is the most common amongst Thai people?
We found many Thai people allergic to rice.
Rice.
It's the food allergy test. But for this kind of treatment, it doesn't mean that you cannot take rice all your lifetime. Just only 3 months that you quit it and take only a little. And after 3 months, your stomach will be absorbed better, and then it will seal. Because when you have intolerance, sometimes the stomach absorb more big particle. So when everything heal, no immune complex anymore after 3 to 6 months, you can continue taking the rice, but just little by little, maybe once in every week or twice in 1 week.
I see. So what if our viewers want to come and consult you? Where can they come, or would there be any process or any way to contact you?
It's very easy. You can have the test at all our branches, which now have 5 branches.
I see.
2 in Bangkok at
Yes.
Sukhumvit 55, Thong Lo 12,
Okay.
at Major Avenue here, Ratchayotin,
Okay.
and at Bangkok Phuket Hospital, and Royal Phuket Marina, and at Chaweng Plaza, Samui. Yeah,
Okay.
Surat.
So many places they can go for. Okay. Unfortunately, that's all the time I have for this episode. I hope you join us again next time. Thank you very much. ขอบคุณค่ะ
Thank you.